Our newsroom does surveys all the time about all kinds of issues because we want to find out from you what's really going on in the North Country. Well, the most popular one ever is the one we just did about healthcare. I'm not surprised. More than 330 people had a lot to say about healthcare problems and solutions in our region. We report back what people said on today's Story of the Day.
Support for Story of the Day comes from Pearsall Wealth Management at UBS Wealth Management USA, subsidiary UBS AG, member FINRA SIPC, 1 Broad Street, Glens Falls.
Hey, I'm David Sommerstein. It's Monday, August 7th, and I'm just going to turn over today's show to Amy Feiereisel, who read through all 330 responses to our healthcare survey and downloaded it all to Monica Sandreski on Northern Light.
Well, the first question we asked was, what healthcare topic are you most interested in? And there were 6 choices: addiction, mental health, prison healthcare, elder care, and the regionalization of healthcare. And we definitely had a front runner. Nearly 40% of people chose the regionalization of healthcare.
Yeah, regionalization of healthcare. So what do we mean by that?
So the full topic name was Regionalization of Healthcare and Consolidation of Services. And what we were referring to there are things like North Country hospitals being taken over by larger city conglomerates. Think Plattsburgh being operated by UVM in Burlington, the St. Lawrence Health System merging with Rochester Regional Health. It's also consolidation, with certain wards in hospitals closing, like the maternity wards in Malone and Messina. And we recently found out that the Lake Placid ER is closing and sending patients to Saranac Lake.
So what did people say in the survey about how regionalization and consolidation affects their lives?
The first was waiting. And Susan Novak is kind of the poster child for the waiting game that so many people described. Novak is 66. She lives in Raymondville outside Messina. Last December, she noticed a strange feeling in her heart, and she described it as a sort of offbeat pumping. Her primary doctor also thought it was an issue and referred her to a cardiologist.
I had hoped I would get in quickly, but the first appointment was at the end of March. And just before I was due to go in, I received a call saying that they needed to reschedule the appointment. And it was again another couple months out. And when that one came along, they called again and they were going to reschedule.
So this happened 2 more times, and Novak says her current first appointment is scheduled for the end of August.
Well, that's really scary. And that'll be 9 months after she first noticed this irregular heartbeat.
Yeah, and she says she has very little faith that, this upcoming appointment will happen. And those long wait times, or just not having a specialist in the area, that leads many people to traveling for care. That was another big issue. Of course, that's no secret in the North Country. Lots of people travel for care to Syracuse, Burlington, Albany.
Well, but just because it's common and happens a lot, it doesn't make it easy.
Not at all. I spoke with a woman in Westport, Marlene Super, whose husband recently fell off a ladder and broke his elbow. So they went to Plattsburgh. They were told he'd need surgery, and they waited for 3 days, and they still didn't have a follow-up appointment or the name of a surgeon. Super says her husband was in a lot of pain, and they were desperate. So the couple drove to Albany. They had an appointment and surgery within 24 hours. And Super says it was a really eye-opening experience for her.
At this point, we're not moving, but we will be looking outside of the area when we need special care. If we ever were to get sick and needed ongoing care, I believe I would look in Boston or Albany or New York or wherever we can get care. Truthfully, I'm losing confidence.
And they had this one-time emergency situation, but Marlene Super was also talking there more about ongoing care. I'm sure we heard from folks about having to travel regularly, too.
Oh, there were so many stories around that. Cancer patients commuting to Manhattan, people with spinal issues driving from Colton to Burlington twice a month. And it's not just rare or really specialized care people said they're leaving for. It's dental, orthopedic, eye care. It's a lack of dermatologists.
And as you heard from people, the travel and the waiting, that has real health consequences.
It absolutely does. Christopher Prue, who lives in Norwood, he went through this 2-year saga trying to get diagnosed and treated after he started feeling pain in his lower body. He waited months to see a local rheumatologist, eventually went to Syracuse and was diagnosed with degenerative hip disease. A treatment he was supposed to get locally was delayed because a machine was broken. And he finally got surgery on his hips this spring, but he was out of work for a year because of the pain. And he said what many others did in their responses too, that he was frightened.
I was very concerned about just getting lost within the system because there are such few providers that specialize in certain areas. You're really at the mercy of time because they can only do so much as far as seeing the clientele.
Oh, that phrase, getting lost in the system. What a rough feeling. I mean, what did people say about their regular relationship with doctors?
Their turnover came up a lot as a concern. Lori Atkinson, who lives in Lowville, spoke with me about her struggle to keep an OBGYN in Lewis County. She said she's had several doctors, that she's loved, leave after just a few years.
So there's really no one here that I trust OBGYN-wise. And then the same thing occurred with a regular care physician. There was a revolving door. I had one and then he left, and my parents are going through the exact same thing. There's just this revolving door, and you cannot get anyone that you can establish a rapport with. You have to keep retelling your healthcare history.
Well, and that brings us back to the first question in our healthcare survey: what topic matters most? And the second, after regionalization, was elder care.
Yes, 25% of people chose elder care as their answer. John Danis lives in Rensselaer Falls in St. Lawrence County. He's 70 years old, and he talked about how turnover impacts older residents.
Because a lot of elderly people are dealing with chronic conditions that kind of evolve as you get into your middle years and older. And maintaining those things really requires having a good relationship with a specialist long term.
What were some of the other major concerns around elder care?
Well, computer literacy came up, a lot about trouble navigating insurance, and transportation was a huge one.
Well, okay, so we've laid out a lot of issues and problems in North Country healthcare. What about solutions? What about good things happening?
Well, so our last survey question actually asked people to tell us about a positive healthcare experience they'd had. And there were hundreds of stories about what's working. People talking about their doctors, providers that have gone above and beyond, local health networks working with bigger cities to make care pretty seamless. And people also recognize that a lot of gaps in care are because of current staffing shortages and providers that just have too much on their plate.
And to pull back a little bit, the whole reason we did this healthcare survey and heard from 330 people and counting across the North Country is we're going to start reporting for a healthcare series, and we wanted to know what people's questions were first.
Yeah, and the big questions we heard were, how do you attract new providers to the North Country and get them to stay and build practices here? How do you keep care personal when hospitals and services are consolidating? What does that look like? How do you age in place in the North Country? Can you? So that'll guide our reporting. And of course, we'll be hearing lots more stories about what people are experiencing, both the bad and the good.
That's our community engagement reporter, Amy Feiereisel, speaking on our morning news show, Northern Light, with co-host Monica Sandreski. There are so many more answers to the healthcare survey than we could fit on the radio, so you'll find more online at ncpr.org. And all of this is feeding into an upcoming news series we're working on about healthcare in the North Country. And that is coming up this fall. Music today by Eddie Lawrence of Moira. I'm David Summerstein, North Country Public Radio.